House Leader, third party.
Thank you, Honourable Speaker. When we speak of the opioid epidemic, often people think of big cities like Metro Vancouver or Greater Victoria, but smaller communities are feeling the impacts as well, and often lack the necessary infrastructure to address the growing crisis. And it is a crisis in Duncan. 2 weeks ago, the Cowichan Theatre was filled with people who came to watch a documentary film and hear a panel discussion on how the opioid crisis is affecting our town. The next day, the elected officials of Cowichan, Mayor, CVRD Chair, MLA, MP, Chief of the Cowichan Tribes, and the Inspector of the RCMP met to discuss how the political leadership can support the ongoing community-coordinated response. What is urgently needed in Cowichan is stable, ongoing funding for Sharps cleanup, low-barrier supervised shelter, local and easily accessible addictions treatment, and transitional and long-term housing. Through you, Honourable Speaker, to the Minister of Mental Health and Addictions, our small community is struggling. What is your ministry doing to ensure that vulnerable people in Cowichan have access to the infrastructure they need to keep the community safe?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and thank you to the member for the question. And I certainly recall very well when the member and I toured her constituency last year and met with people who are living with the addiction crisis, and also people who are on the front lines of that crisis, and also met with Cowichan tribes to learn about their experience with mental health and addictions and the support that they need, Honourable Speaker. So, as the member knows very well, as people across British Columbia who are living with this crisis every single day, as they know well, we have inherited a system for mental health and addictions that has enormous gaps and that is a very fragmented system. We have been escalating our response to the overdose crisis every month, every week, every single day, Honourable Speaker. We are on Vancouver Island in particular. The member will know that last year we opened our Place Therapeutic Recovery Community, a 40-bed innovative recovery community that will serve people on Vancouver Island. Also, Honourable Speaker, in the Cowichan Valley in particular, I know that Island Health has established a new intensive case management team to provide outreach and support for people who are struggling with addiction. They're saving lives through significantly expanded access to naloxone, as well as the overdose prevention site in Duncan. They're funding a nurse practitioner to receive addictions training, Honourable Speaker, specialized addictions training, in order to provide better support in the future to people living with addiction, and they're planning for another nurse practitioner to proactively link people at high risk with medication-assisted treatment. Honourable Speaker, we are working overtime. I'm happy to meet with the member to talk about her community in more detail. We have a lot of work to do. Every single life that's lost is preventable, Honourable Speaker. It takes all of us working together as a province, all hands on deck, to solve this unprecedented public health emergency that's affecting every community across British Columbia.
House Leader, third party, on a supplemental.
Thank you, Honourable Speaker, and I appreciate what the Minister highlights. And I also want to point out that the Cowichan community itself has responded. The Community Action Team has, among other things, established a 6-bed sobering centre, worked tirelessly on educating the public on the reasons for addiction, trauma, and stigma. In 2016, Island Health did indeed open an overdose prevention site where more than 22,000 individual clients have visited since it opened. And early every morning, rain or shine, a group of business owners and volunteers show up to clean storefronts and sidewalks, removing drug paraphernalia, garbage, and human waste from the street. Cowichan is great at rallying together to help those in need, but we are growing impatient for long-term solutions. What is desperately needed is an accessible local addictions treatment centre. Through you, Honourable Speaker, to the Minister of Mental Health and Addictions, will the Ministry commit to looking at funding an addictions treatment centre in Duncan?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and I'm certainly happy to sit down with the member and discuss the specific needs in her community. Honourable Speaker, we have, as the member has mentioned, significantly expanded access to overdose prevention sites, and I would note that the overdose prevention site, as the member said, has had thousands of visits. Hundreds of overdoses have been reversed, and not one single life has been lost, Honourable Speaker. That's very, very important. We also are training more doctors and nurse practitioners in order to be able to prescribe medication-assisted treatment for people who are living with opioid disorder. According to all of the addiction specialists in the province, the first line of treatment for opioid addiction is Suboxone. And, Honourable Speaker, we have significantly increased the number of prescribers and the number of patients who are on medication-assisted treatment. But, Honourable Speaker, every single day we are looking for new solutions. We need new tools in our toolbox. We recognize that. The BC Centre for Disease Control estimates that as a result of our efforts, 4,700 lives have been saved in the last year and a half. But, Honourable Speaker, the number of deaths still remains unacceptably, horrifically high, and we will not rest until we turn the tide on this terrible crisis.